Namaste. In this session, I'll begin with a new chapter, Reproductive Health, which will be the last chapter in the unit Reproduction. Reproductive Health. Now, what is the meaning of reproductive health? Here, the reproductive health, it simply means reproductive organs with the normal functions. Reproductive organs with a normal function. Now, this reproductive health also have a broader view. Now, when considering a broader view, I need to include emotional and social aspects of reproduction. So then it's a broader perspective. So it's a broader perspective of reproductive health. Now here, World Health Organization also defined reproductive health. What according to them the reproductive health means? According to World Health Organization, reproductive health means it will be total well-being of a person in all aspects of reproduction. Generally, we think health means absence of disease, but according to WHO, they say not only absence of disease, but there are certain other things that we need to consider to say a particular person is healthy. Now, so he or she should be okay physically, emotionally, behaviorally, and socially. The person should be normal, and the society with such normal persons or healthy persons, we say such society as a reproductively healthy society, right? Such a society is said to be reproductively healthy. Okay, so a society to be reproductively healthy, the people in the society, they must have right normal physical characters, should have normal emotions, should have normal behavior, and the behavior with the other people also should be normal in a society. Then that socially we call it, and then such a society is reproductively healthy. So this is how they define, in terms of WHO about reproductive health. Now, what is the significance of maintaining a reproductively healthy society, and what will be the different methods to achieve such a reproductively healthy society? All these things we'll discuss in the coming sessions. Now we'll see here about reproductive health, the problems and strategies. Under this, I'm going to talk about family planning, the various methods of this family planning and all. I'll be talking in the coming session. So this is just an introduction. Okay, so here the family planning, it was initiated in India in 1951, and according to this family planning, what they say is children by choice and not by chance. Right now, here when coming to India, India was among first countries in the world to initiate such action plans and programs. So it was among the first countries to initiate such action plans and programs, and at that too at national level, to achieve reproductive health. Right. So we come to know that such family plannings were initiated in India in 1951, and these were different programs which they initiated at national level and to achieve this reproductive health. Now there are much improved programs introduced in India. So improved programs have been introduced in India. Now coming to these improved programs, under these improved programs we have is RCH, that stands for reproductive and child child health care. Reproductive and child health care programs. Right. So these improved programs cover wider. So they will be covering wider reproduction wider reproduction related areas. So they are covering wider reproduction related areas under these RCH programs. Now these RCH programs actually will help in creating awareness. We'll see what are all those things that are covered under RCH programs. So RCH programs. So under these RCH programs, these actually help in creating awareness among people. So they are creating awareness among the people about various reproduction related aspects. They are covering about various reproduction related aspects, and also they help in supporting this support for building up reproductively healthy society. Help in, okay, they also help for building up reproductively healthy society. So these are actually the major tasks under, okay, RCH programs. Right now we'll see here the following will be the different methods here used for spreading information, okay, about these reproductive health. Now here how they are spreading these information. So here the government as well as non-government agencies are taking the help of okay, audio visual and also print media like newspapers and so and so, okay, and they have taken many of these steps to create awareness about reproduction related aspects. And again parents, okay, teachers and close relatives and also the friends will play a very important role in passage of reproduction related information from person to person. Let us see the various reproduction related aspects that are currently under RCH programs. Okay, so here the first one is introduction of sex education in schools, and okay, introducing sex education in schools actually helps in discouraging children from believing myths and misconceptions regarding, okay, the sex related aspects. So this is one advantage of sex education in schools, right? Now, and another one, proper information about reproductive organs, okay, right? So how the reproductive organs function, right, the both male and female reproductive organs, their structures and so on and so, okay, and also information on adolescence and related changes. So there are so many right changes that take place during adolescence, okay. In coming classes we will come to know more about those, okay, adolescence, okay, what actually it is, and what will be the different changes that take place during the puberty age in male as well as females here. Now again, information on safe and hygienic sexual practices, right? So that is another information under RCH programs that is right given to people in the society. So now again, right, information on sexually transmitted diseases, okay, like AIDS. We know nowadays all around the world there are many STDs, right, and among them this AIDS is creating a havoc, okay, right. Now we need to know how those STDs will spread from person to person, and to know about those diseases actually help in preventing from getting infected. So, right, so the proper information about reproductive organs and information on adolescence and related changes, information on safe and okay, hygienic sexual practices, and information on STDs like AIDS. Okay, these actually help adolescent age group, actually help adolescent age group people, right, to lead reproductively healthy life, okay, right. The next one, educating people especially those who are in fertile couples. Fertile couples are the one who will be capable of having children, right? And those who are in marriageable age, okay? And information about available birth control methods. So these birth control methods we'll discuss in detail, okay, in the coming sessions, okay? So what will be different birth controls actually help in controlling and spacing the births in a family. The next one, information on care of pregnant mothers, okay? And then information on postnatal care. So the postnatal care, which means, okay, after the childbirth, how the mother have to take care of her children, okay, or her newly born baby. All are the things what we call under postnatal care, okay, of the mother. So the importance of the mother's milk and what are all the different care that a mother have to take care of her newborn, okay, will be all under this postnatal care, okay, of the mother as well as, right, child. Then even the information about importance of breastfeeding. So here in many cases there are certain women, okay, who are busy with the work, are unable to give right milk to the young one. Now the initial days of milk to the young one is very important and plays very crucial role in the development of the newborn, okay, right? So that is what the importance of breastfeeding here. Now these points about, okay, will help in bringing socially conscious healthy, okay, society. Now we'll see one more information, okay, on equal importance, okay, for both male and female child. So here these points, right, here one point I would like to add here, information on equal importance for both male and female child. Nowadays right from the past, right, not just nowadays, right from the past, we see there is a lot of inequality between the male child and female child, okay? So in many families they regard female child, okay, not giving much importance, and they do not like to have a female child, and they like to have only a male child, as the male child carries the surname, okay, for further generations and so on and so, okay. There is a lot of right issues that even now they go with this male, and even many educated families also they like to have a male child instead of a female. So there is a, we'll discuss all those things, okay. And these RCH programs like to give that equal importance, okay, for both male and female child. So awareness on these, okay, points will actually help in bringing, help in bringing socially conscious, healthy families of desired size. So they actually help in bringing, okay, socially conscious healthy families of desired size. So these points here. Now the last one, awareness of problems due to uncontrolled population growth, and it is one problem in India. So there is an uncontrolled population growth. So in coming classes we come to know, okay, the world population is around 7.2 billion and India has 1.2 billion, so contributing a large amount of population to world population, okay, right. Now we'll talk about those things, right, in the coming sessions. And even we have okay, from past, present, okay, there are problems in the societies like okay, sexual abuse, right, and information even on some sex related crimes, right. So these information, okay, on such points help, okay, people to, okay, take necessary steps, help to take necessary steps to prevent and thereby helps in building, okay, socially responsible and healthy society. Okay, so concentrating on such issues like social abuse, okay, and sex related crimes, and okay, problems due to uncontrolled population growth will actually help, okay, to bring a very responsible and healthy society. So here these are the various programs that are carried out under these RCH programs, and they are trying, okay, their best to bring out a reproductively healthy society. Implementation of those RCH programs, right, they require in fact strong infrastructure facilities. They require even professional, okay, expertise, and even material support is required. Now when coming to these strong infrastructure facilities, they are very important, okay, as they provide medical assistance and care to people in reproduction related okay, problems like the pregnancies, then delivery of newborns, then STDs, sexually transmitted diseases, then abortions. In the coming sessions we will talk even about these abortions, okay, how naturally they can take place or artificially. We'll talk about in detail in the coming sessions about even abortions. Then contraception methods, okay, are various methods that actually help in preventing conception, I mean pregnancy. So this also we'll talk in detail in the coming sessions. Then about the menstrual problems and infertility is a condition where a couple are unable to have their own children. So we will also address about or talk about these infertility problems and how these infertility problems can be solved, okay, almost at the end of the chapter we'll talk about all these things, right. So this is okay, all about those RCH programs and right, and implementation of those RCH programs require a lot of okay, support, that like infrastructure and professional and also the material support. Okay, now if we see, right, a better awareness about sex related matters, okay, an increased number of medically assisted deliveries, and better postnatal care leading to decreased maternal and infant mortality, which means, okay, the mother and child deaths can take place, okay, if we are able to decrease, okay, the number here. And again, increased number of couples with the small families, okay, and then better detection and cure of STDs, and even increased medical facilities for all sex related problems. If such conditions or okay, such situations take place, then all these things indicate, okay, so all these are the things that actually indicate, right, indicate a increased reproductively healthy society. So all this, okay, if you are able to observe in a society, then definitely the reproductive health increased a lot, okay, in that, okay, society.